Katie, tell us a little bit about what you do with home health.
So I've been a home health therapist for like 17 years. We work in people's homes where we go in, we get referrals from providers and work on a variety of different things with them. Typically, our main focus is helping them to become more independent in the home with, mobility, being able to get in and out of bed, get up and down from a chair. Once we've established those kind of patterns, then we can focus on other things. But oftentimes, they're always supposed to be homebound, so they're in their home, and our goal is to help them become not homebound so they can get back to society and back to their daily lives.
If I'm a patient and I'm having surgery and I get a call from the home health company for care after surgery, what should I be thinking about that?
So hopefully they know that they've been referred, that their physician is referring them to home health, so they're aware that we're going to be calling. When they call, we try and give them some information about when we'll be coming after surgery. If they have certain questions, we can answer those before, just so that they're prepared and know that we will be helping them following the surgery to advance with whatever their surgeon has in mind for them.
Mm-hmm. And then once a patient's worked with you in home health, how do you decide when they're ready to go on to outpatient physical therapy, for example?
So it depends on kind of why they were referred in the first place. Usually in surgical cases, we limit it, especially like a knee replacement or hip replacement. We try and get them to outpatient as fast as possible, just because the outcomes seem to be better the faster we can get them there. So most of the time we see people about 2 weeks in the home, and then they see their surgeon for follow-up. And at that point, we send them on their way to outpatient. If it's something that's not a surgically based thing, then we will see them in the home as long as we are showing progress and they're still homebound.
Okay, I see. In medicine, there's transitions of care. So a patient is coming from home, for example, and then they go to the hospital and have surgery, and then they're on the floor, and then they're back home, or maybe they go to rehab for a while, and then they go home. What are some of the challenges that we see during those transitions?
I think when we have a lot of providers involved, like you said, there's these multiple places that they go. They go from the surgery to the floor to skilled nursing to home, and any transition of care, there's a chance for a drop in communication. Often patients, when they go in those transitions, don't understand fully the information that's being sent with them that they've been educated on, and so every time there's the opportunity for them to have misunderstandings, and often we also see a lot like medication changes can be an issue in those transitions of care. The hospital will put them on some type of medication that their primary care doesn't know about, and so when they get home, they're confused what medications they should be taking. So there's a lot of issues that, if the communication doesn't flow very well, can arise that can cause some problems for the patient.
Mm-hmm. It is confusing. I think if I was a patient getting all this information, it would be hard to keep track of everything.
Yeah, it really is.
And I think there's a lot of value in the home health team reinforcing things that were said in the hospital. Maybe the patients don't remember everything that happened in the hospital. Some people don't remember their hospital stays at all.
Yeah.
And they get home and they have no idea what was said or what to think.
Yeah, recently, my dad was actually in the hospital recently and had that kind of experience where he wasn't computing things as well as he normally does. And when he got home, there were kind of parts that he just didn't remember, he didn't understand. And the home health agency that came in was awesome. Helped reinforce the things that he'd been taught. They made sure his medications were what they needed to be, and communicated with his primary care to help his primary care also understand what had happened. So
I had a funny experience. This patient was had a lumbar fusion, and she was a little bit confused. I think she had a little bit of mild dementia before surgery, and I go in there to see her, and she didn't really remember that she had had surgery.
Oh, at all.
But she said to me, "You are the best doctor I've ever had. You came to my home." to see me today. I was like, well, this is the hospital.
Yeah, she didn't even know.
But it just made me think about how wonderful it must be for people to have that care come to them in their home, where they really should be able to be functional and independent. And the other thought I had was, sometimes we see patients now on telemedicine, and it's fascinating because you get a glimpse of what their home looks like, and you learn about them a little bit more than if you just see them in clinic, because it's in a clinic environment. You don't see anything about their living environment. And so speaking of communication, I think that there's a lot of contextual information that the home health team can gather to help the clinical team making decisions and knowing what's going to be best for patients.
Yeah, I agree with that. With kind of thinking off of that, I had an experience not long ago. We had a patient who had surgery on his ankle, and actually multiple surgeries, and was non-weight bearing. And he came home and he was not able to maintain that because he had another neurological condition, and it was affecting his strong leg. The surgery was on his strong leg, and he was non-ambulatory before. And so being in his home and seeing how he was moving, we were able to communicate back to the provider that, I know you want him to be non-weight bearing, but for this patient, it's probably not realistic. So what can we do to, how can we approach this to help him be successful?
Yeah, I love that. Well, I appreciate you presenting today. And I think that one of the benefits of our morning rounds and the conference that we have coming up and other opportunities is, if the providers, nurses, physical therapists across the board, if we know each other, I think that enables better communication. We're able to directly contact each other. We're able to know who everybody is and what their skill set is. And I think that there's been a lot of value in just knowing who the medical community is, and then working together in a setting of constant and good communication to help take care of people.
Agreed.
Thank you.
Thank you.